NCLEX tips. 1. Do not read into the question. Never assume anything that has not been specifically mentioned in the question, and do not add extra meaning or history to the question. Do not make up a story to validate choosing an answer. 2. You have all the time, all the resources, and all the staff you need. 3. Least invasive to most invasive, least restrictive to most restrictive. Restraints are rarely a good choice. 4. Avoid using absolutes always, never, must, etc. 5. Assess the client first before implementing a treatment or action, if there's a choice that pertains to assessment of the patient. It is usually the answer, assess and lessen distress. 6. Priority goes to assessments and answers that deal with the patient. Patient-focused, directly and not with machines or monitors or equipment, unless the question is specifically asking about them. Example: auscultate fetal heart rate before checking the monitor. 7. If it is the first time doing something for or with the patient, such as vital signs upon admission to the floor or unit, or when a transfer is involved, the nurse must complete the assessment including vital signs. 8. If patient is an adult, answers with family options can be ruled out, unless patient is not competent to make own decisions. 9. In emergency situations, mass casualty, patients with greater chance to live are treated first. 10. If you are asked about the first action you would take in a prioritization or discrimination question, think, if I can only do one action, and then I must go home, what will the outcome be? 11. Therapeutic communication. Reflect feelings and provide correct information. 12. Do not ask why questions, or yes or no, and do not say I understand. 13. An answer that delays care or treatment is usually wrong. Example: reassess in 15 minutes, monitor the patient for a continuation of symptoms. 14. When determining interventions to enhance a client's wellness, consider options that promote healthy nutrition, regular exercise, proper weight maintenance, proper rest, and avoidance of harmful chemicals, like nicotine, and risk-taking behaviors, like not wearing a seat belt. 15. If two of the answer choices are the exact opposite, one is probably the answer. Example: bradycardia, tachycardia. 16. If 2 or 3 answers are similar, none are correct. Asterisk: be careful. Sometimes answers may seem similar but in fact are saying something different. 17. Always look for the umbrella option, one that is a broad universal statement and usually contains the concepts of the other options with it, often the correct answer. 18. If you have never heard of an answer, do not eliminate it, work around it. If you can safely eliminate all other answers, that is your answer. If you are down to 2 answers and you know one answer is right, go with what you know. 19. Prioritize actual problems over potential problems. 20. Do not leave the patient, think safety. 21. Do not do nothing, you always have to do something. 22. If the question is about endorsement, always report anything new or different to the next shift. 23. Only select document if the assessment is normal. 24. Put patients with the same or similar diagnoses in the same room. Clean versus dirty patients. 25. Never increase a patient's fluids to catch up. 26. Answer SATA questions as true or false for each answer option. 27. Rephrase the question in your own words. This ensures you understand what the question is asking. If you cannot rephrase the question, you do not know what the topic is. 28. If you cannot determine the topic of the question, read all answer choices. To help you understand the problem, look for patterns. 29. Try not to determine the answer before reading the answer. Choices: NCLEX uses traps and answers that scream "pick me," but are wrong. 30. More often than not, pain will not be your answer. Pain is considered psychosocial. Exception to this rule are signs and symptoms of compartment syndrome. 31. Try to focus on the here and now as much as possible. 32. With positioning questions, you are trying to prevent or promote something. Evaluate the outcome of each option. 33. When the question asks what is essential, think safety. 34. If you do not know what a word means, try to break it down using medical terminology. A. Example: rhabdomyosarcoma, muscle, myo, tumor, sarcoma, tumor of the muscle tissue. B. Same idea applies to medications. Use suffixes and prefixes to recognize classifications. 35. Make an educated guess. If you can't make the best answer for a question, after carefully reading it, choose the answer with the most information. 36. When in doubt, safety. Keep them breathing, keep them safe. Thanks for watching. Please share and like for more videos.